Welcome to Health and Lifestyle. Your journey for a better living starts here. Our subject for today is diabetes, so let's dive in.
Okay, well, you clearly don't care, so why don't you just leave?
I would like to stay. This pertains to me.
I would like you to leave. Why don't you go outside and take a shot of insulin and have a nap, okay?
Why do you always assume I have diabetes?
You have a glass of apple juice and tell me that you don't have diabetes, okay? All right. See? Just the noise you made when you stood up. I could...
We are going to focus on diabetes mellitus. So, diabetes mellitus is a disorder of carbohydrate, fats, and protein metabolism. It results in lack of insulin, resulting in hyperglycemia. This is high blood glucose. A progressive dysfunction of pancreatic beta cells with a decline in insulin secretion leads to persistent hyperglycemia. High blood sugar results either because the body does not produce enough insulin or because cells do not respond to insulin produced. This is insulin resistance. Symptoms of diabetes include polyuria, this is frequent urination, polydipsia, this is increased thirst, polyphagia, which is increased hunger, weight loss, and in severe conditions, we might suffer from retinopathy or cardiovascular diseases and nephropathy. We have different types of diabetes. So we have type 1 diabetes. It results from cellular mediated autoimmune destruction of the beta cells of the pancreas. In this type of diabetes, the rate of beta cells destruction is quite variable, being rapid in some individuals, such as infants, and slow in others, as an example in adults. Insulin therefore has to be replaced by regular subcutaneous injections, and blood glucose levels must be frequently monitored to manage the risk of hyperglycemia.
We just fired the person that does that, but now you have been promoted. You are now one of my elite employees.
We also have type 2 diabetes. It is characterized by high blood glucose in the context of insulin resistance and relative insulin deficiency. It is associated with morbidity and mortality, resulting from its microvascular and macrovascular and neuropathic complications. This form of diabetes usually goes undiagnosed for many years because the hyperglycemia develops gradually and at earlier stages is often not severe enough for the patient to notice any of the classic symptoms. Lastly, we have gestational diabetes. This is glucose intolerance, which is first recognized during pregnancy. At least 6 weeks after the pregnancy, and the woman should receive an oral glucose tolerance test and be reclassified as either being diabetic or normal glucose levels. Gestational diabetes complicates about 8 to 9% of pregnancies, and hyperglycemia in pregnancy is responsible for increased macrosomia. This is whereby the baby is born overweight, more than 4.5 kilograms, and also preterm birth. So, what causes diabetes? One of the reasons is genetic defects of beta cells. So, several forms of diabetes are associated with monogenic defects in beta cell function. This is onset below 25 years. So, it may affect genes important for beta cell glucose sensing, development, function, and regulation. Genetic inability to convert proinsulin to insulin results in mild hyperglycemia. Similarly, the production of mutant insulin molecules has been identified in a few families and results in a mild glucose intolerance. It is most often associated with renal cysts but rarely causes diabetes. Also, diseases of the exocrine pancreas causes diabetes. So any process that diffusely injures the pancreas can cause diabetes. Acquired processes include pancreatitis, trauma, infection, pancreatic carcinoma. So chronic pancreatitis can cause general inflammatory changes in the pancreas, which can cause diabetes. Also, infections have been found to cause diabetes. So a variety of infections have been etiologically related to the development of diabetes mellitus. Approximately 20% of infants who are infected with rubella virus at birth develop autoimmune type 2 diabetes later in life. Lastly, a large number of commonly used drugs have been shown to induce insulin resistance and impair beta cells function. and can lead to the development of diabetes mellitus in susceptible individuals. Lastly, the risk factors of diabetes include obesity, high blood pressure, high cholesterol levels, cardiovascular diseases, and retinopathy. Hope this information is helpful to you. And lastly, also remember to live healthy and live fully. Subscribe to get more information about lifestyle diseases and any other chronic condition. Thank you.
My daddy has a gold tooth. Wow, gold tooth? My dad has a gold tooth. Look, my dad has diabetes.